Doctor Paws Pet Therapy is an organization that trains volunteers and their dogs to visit and brighten up the days of hospital patients and nursing home residents. We're going to visit with Terry Seraceno, head of Doctor Paws Pet Therapy, and her very special dog, Sassy. Look at that face. Makes you want to reach out and pet it. How do you recruit volunteers and dogs?
Actually, a lot of it is word of mouth. People will come and see us bringing the dogs in and they'll ask us how they can do this. There's a lot of people out there volunteering right now with their dogs that take them to nursing homes. The whole purpose of belonging to an organization, we're through Therapy Dogs Incorporated, which is in Cheyenne, Wyoming. The whole reason to belong to a group is because you have to have insurance. Each dog here has their own $3 million liability policy. $3 million. Just in case something happens, they're all insured. And a lot of the facilities like that, so that when we come in, they know that these dogs have been tested and they're worthy of wearing the collar here that says I'm a therapy dog.
We think dog therapy is a wonderful, wonderful addition to our armamentarium to treat the patients.
You're a nice baby.
We love these dogs. They come to the hospital. They really perform a wonderful service for the patients. The patients love them.
Everybody says that the dogs have a therapeutic benefit. You find that so?
Absolutely, absolutely. The patients really warm up to them. The dogs give them a feeling of being at home and a sense of being touched and felt by these wonderful animals. Sometimes the benefit can be longer than the immediate period that the dog is in the presence of the patient, because this is something that they may think about the rest of the day, and it gives them an uplifted feeling. So anything you can do to improve their well-being is certainly appreciated.
Unrestricted love, you know, no conditions, absolutely. Beautiful creatures, and they're nicer than cats because they respond immediately.
Well, if I may make a pun, it gives you thought for paws, doesn't it?
Yes, it does, absolutely. Wonderful. Thank you so much.
We thank you, sir. Well, what criteria do you look for in these dogs?
Well, we're looking for dogs that are well behaved. We don't want to see dogs that are pulling people into the hospital or the nursing homes, because that's a liability. We want a calm dog, a dog that wants to be petted for an hour. As you can see, she's not going anywhere, and she's perfectly happy to be petted. And after about an hour, we stop, because that's usually about their limit.
Now, you put the dogs and their handlers through a special training period. What's that like?
We first go over the dog before they walk into the facility to make sure they're a nice dog, and the tester has to be aware of dog behavior. A dog with a tail between the legs and maybe hiding behind its owner is not a good sign that the dog's very comfortable. So sometimes we'll tell them to take their dog back to an obedience class, work with them, and come back and visit us. They have to have 3 one-hour sessions with their dog to qualify. Their paperwork must be filled out, and the dog must be 1 year of age.
After they've qualified, what comes next?
Then they take their paperwork, they mail it into Therapy Dogs Incorporated. We do not charge for any of the testing. We are all volunteer. It's all free of charge. The paperwork is mailed into Therapy Dogs Incorporated, and there's a small fee that covers them for 1 year with the insurance. Hi, I'm with Doctor Paws. This is Sassy.
About how many visits do they make a year? Any idea?
Depends on the individual. I mean, you could do this probably every day for the rest of your life. I know I wouldn't get bored with it. We tell people to leave it to possibly once a week and find a facility that they're comfortable with, and then continue visiting that facility so that the people and the patients get used to the dogs and used to them coming. These
volunteers must be wonderful, dedicated people, I must say.
They are wonderful people. We've got some wonderful people in our group. It takes a special person, and a lot of people will ask me when I'm testing them, what do I say when I'm visiting someone I've never met before? And I says, well, just strike up a conversation about, have you ever had a dog before? If they've never had a dog, they've had some kind of animal in their life, and they can make that connection. And usually all they need to do is just pet the dog, and they feel much better, much calmer.
Now, if any volunteers were interested in joining your program, how would they contact you?
Well, thanks to the internet, they can go to www.drpaws.org and just click that on, and they can send me an email at the bottom of the page. We have testers all over Michigan. We test at Botsford, St. Mary's Hospital in Livonia, and Kingswood Hospital in Ferndale. And we do also have locations in Linden, Michigan also.
Terry, it's been a pleasure visiting with you today and learning about your program.
Thank you.